Hello everyone and welcome. Today we're diving into a condition that affects the vision of many, often after cataract surgery: intraocular lens or IOL dislocation. We'll explore what it is, why it happens, and what can be done about it. So, what causes an IOL to dislocate? There are several factors. One major culprit is pseudoexfoliation syndrome, a condition where abnormal protein material accumulates in the eye. Other contributing factors include trauma to the eye, advanced age, uveitis, inflammation inside the eye, and connective tissue disorders like Marfan syndrome or Ehlers-Danlos syndrome. Sometimes the lens capsule, the bag that holds the IOL, can weaken over time, or the zonules, the tiny fibers that suspend the lens, can break down, leading to instability. Now, let's talk about the pathophysiology. Typically, an IOL is securely positioned within the capsular bag, which itself is anchored by those zonular fibers. When the zonules weaken or break, or when the capsular bag itself loses integrity, the IOL can shift out of its intended position. This displacement distorts the way light focuses on the retina, leading to blurry or distorted vision. The degree of visual disturbance depends on the extent of the dislocation. While precise global numbers are difficult to obtain, IOL dislocation is a relatively common complication following cataract surgery. Studies suggest that late IOL dislocation can occur in anywhere from less than 1% to over 10% of patients, many years after their initial surgery. The risk increases with age, and as we discussed, is significantly elevated in individuals with pseudoexfoliation syndrome or a history of eye trauma. What are the telltale signs? The primary symptom is usually a gradual decline in vision or a noticeable blurriness. Some patients experience double vision, glare, or halos around lights. You might also notice a feeling that something is off with your vision, or that your prescription is constantly changing. In severe cases, the dislocated IOL can even be visible as a dark shadow in your field of vision. Diagnosing IOL dislocation involves a comprehensive eye exam. Your ophthalmologist will assess your visual acuity, perform a slit lamp examination to examine the structures of your eye, and use dilated fundus examination to view the position of the IOL and the health of the retina. Imaging techniques like ultrasound biomicroscopy or optical coherence tomography, or OCT, may also be used to further evaluate the degree of dislocation and assess the condition of the supporting structures. While we don't necessarily classify IOL dislocation into rigid types, we can categorize it by the direction and severity of the displacement. It can be subtle, with only a slight tilt or decentration, or it can be more pronounced, with the IOL completely dislocated into the vitreous cavity, the gel-filled space in the back of the eye. Treatment for IOL dislocation depends on the severity of the dislocation and the impact on your vision. Mild cases might be managed with glasses or contact lenses. However, more significant dislocations usually require surgical intervention. Options include repositioning the existing IOL and securing it to the iris or sclera, the white part of the eye, or replacing the dislocated IOL with a new one. The choice of procedure depends on the individual case and the surgeon's expertise. Unfortunately, there's no guaranteed way to prevent IOL dislocation altogether. However, certain measures can minimize the risk. If you have pseudoexfoliation syndrome, regular eye exams are crucial for early detection of potential problems. Avoiding eye trauma and following your surgeon's post-operative instructions carefully after cataract surgery are also important. For surgeons, meticulous surgical technique during the initial cataract surgery, particularly during capsular bag creation, is paramount. The prognosis for IOL dislocation is generally good with appropriate treatment. Surgical correction can often restore excellent vision and alleviate symptoms. However, as with any surgery, there are potential risks and complications, such as infection, bleeding, retinal detachment, or glaucoma. Recent research is focused on developing more stable IOL designs and surgical techniques to reduce the risk of late IOL dislocation, including improved methods for scleral or iris fixation, and advancements in capsular tension ring technology to provide better support to the capsular bag. Thank you for joining us today.